Hello, my name is Amy Loeb. I'm the Executive Director of Peconic Bay Medical Center. I'm also a nurse and a mother, and I know how important it is to find the right place to have your baby. We are so grateful to have the opportunity to show you all of the resources that we have in order for you to welcome your new baby. I hope you enjoy it.
My husband and I chose Peconic Bay Medical Center to deliver our baby because we felt very comfortable here. We wanted a community feel from the moment that I went into labor through the entire process. We had no worries except for getting our child into our arms, and they took care of everything else for us.
The experience for a birthing person is very unique because we have the community hospital experience with all the high-quality subspecialties that you would need and expect from a major medical center.
The beautiful thing about Peconic is that you have the powerhouse of a Northwell behind you, so you have all your modern equipment, all the modern technology, all the modern protocols, but you have that small community hospital feel where I think patients who come here think that they're the only patients that are there that day. And I have patients that are willing to travel 45 minutes to an hour past other hospitals to come here to get this experience.
They give individualized care. The women are not treated like numbers. They're treated like women in the community, and they're treated like a person.
Hi, I'm Dr. Brian McKenna, the Managing Director of Women's Health Services here at Peconic Bay Medical Center. We're standing right outside the front entrance to the hospital, and we are directly across the street from the parking lot, which is conveniently located. We also have valet services if you arrive and need that. We're going to walk into the medical center, and I'm going to show you exactly the process that you might have when you arrive here for various reasons. Upon entry to the medical center, you have to check in at the front desk. And at the front desk, they will guide you to whatever area you need to be brought to. Immediately to the right of this lobby is the pre-surgical testing area. Many times patients will arrive here in advance of a planned surgical procedure or in advance of a planned surgical delivery. The admitting office is also located in the same area. Here in the admitting department, much like at the front desk at a hotel, the staff will greet you and will make sure that all the paperwork is in order for your arrival here at the medical center. From admitting, you might be directed to the pre-surgical testing area, which is further down here. If you're coming in advance of your planned procedure or delivery, you may have to visit with pre-surgical testing. In pre-surgical testing, there is a series of interviews that may occur by staff members and maybe members from the anesthesia department to determine if you have any special needs during your admission here or in advance of your admission here. So pre-admission testing is very important. They also may order certain tests to be completed before your arrival here. Once you've presented to the admitting department, if you're not coming for a pre-surgical event, but you're coming to be admitted to the hospital, you'll be directed to the areas of concern. For example, if you're a patient who's expecting to have their baby in the immediate future, you might be brought up to the maternity unit. Or if you're someone coming for surgery, you'll be brought to the pre-surgical unit. Here is the emergency entrance at the rear of the hospital. And as you see, there are ambulance bays. So if you come by ambulance, you'll be brought in right here. But if you arrive and you're going to ambulate in, you come in through the main door. So we'll walk that way. When you arrive at the emergency room entrance, which is at the rear of the hospital, you'll notice that there's ample parking. And you'll present by walking down this corridor to the main entrance to the emergency room where the staff will greet you. Once we come into the emergency room entrance, you will be evaluated by the emergency room staff. If you're in labor, they will quickly evaluate you and then bring you up to labor and delivery. Or if you have another emergency, you'll be brought in like any patient who has an emergency and be examined and triaged, and then the decision will be made what level of care you need. Once you come in here and we go to maternity, the maternity staff will then assume your care, and you'll get to see exactly what that unit looks like as we go there. As we continue our journey to the maternity center, there's a small waiting room here. It's a comfortable little spot, quiet, some chairs, a nice television, a small refreshment area, and a bathroom. And your family members may wait here for a few minutes until the actual reception is had for the patient in the maternity center proper. This is the entry to the maternity center. We're going to walk up this little ramp. Here we are at the entrance to the maternity center. It's a secure entrance, so the escort will allow you in and the nursing staff inside will welcome you at the desk. When you arrive on the unit, what you'll notice is we have a very nice nurses station, and you'll be taken by the nursing staff into whichever room you're going to be in.
When you're in labor, it's usually a very long process, and the delivery room staff, doctors, nurses, midwives, PAs, all work together as a team because we spend so many hours together, day by day, week by week, that it is a family that is up there taking care of the patients.
It's not a chore. I'm not coming in to do my job. I feel like we're walking in and I'm among friends, and I think that also spills over into the patient experience. I think they get that feeling that, you know, it's not just business as usual. It's a friendship here.
I'm a surgical resident here. I've been here for 4 years. I've had the pleasure of working with many of the OB-GYNs on staff here. The nurses on the floor were great. They were very welcoming. As soon as I came to the unit, I knew pretty much everyone that was there, which was very nice. I met anesthesia very early in my labor, and then I also knew when the obstetrician was there, what they were doing. They told me the steps that I would expect soon and kind of what the outcome of each step would result in.
We have board-certified obstetrician as a house officer, board-certified anesthesiologist, and board-certified neonatal providers on site.
We offer full-scope care for GYN as well as obstetric patients. We deliver our patients here at Peconic Bay Medical Center, and we have excellent outcomes and happy patients. The most important thing I hear is that they're coming back to us. That's the biggest accolade I can get, is that they want to have more children with us.
I know, especially for first-time moms, it can be very stressful. They don't know what to expect. And from the moment they get here, they're really put at ease by the staff. We have very dedicated staff here. The doctors are really, concerned with making sure their patients are happy, making sure that we get the best outcomes possible. The nursing staff, a lot of them have been here for 20, 30 years. They're part of the community. And so they have a proven track record of giving excellent care.
I came to Peconic Bay today for an induction to have a baby. And so far, it's just been wonderful. They have been very attentive and informative and extremely caring. I have come here previously for a birthing experience, and that was wonderful as well. And then this was an induction, and that's, a whole new experience of unknown. It's just been a very wonderful experience.
They answered all our questions, they were compassionate. It's been a great experience so far.
What happens when you come in, you'll have your baby, and your nurse is able to follow you throughout the whole process. And you may even see them the following day as you're a postpartum patient. This creates a unique bond between you and your nurse, and it's a very comfortable situation where you always see a familiar face.
Here you have that really nice continuity of care. So when you come on the floor, if there's a problem, they know who they need to call for. So the patients, I think, have that sense of security that they're being well cared for.
As a community hospital, we have a very high nurse-to-patient ratio that makes it feel like you have your own private duty nurse.
Our nurses are triple certified, cross-trained in both labor and delivery and postpartum. This is different than some other institutions, so we're really proud of that. So they give you excellent and the best care possible.
Our ultimate goal is for a healthy mom and a healthy baby, and also to respect the couple's wishes. If that is to have a vaginal delivery, that's great. We want you to get that vaginal delivery. We will not push you to do anything you do not want. If you do not want an epidural, you do not need to get an epidural. We support you.
I felt like I made the right choice for my family and my child, and it was a wonderful experience.
Another great part of the obstetrical care that we have here is in-house 24/7 anesthesia services. Depending on what your needs are, every patient is different. Anesthesiologists will come and speak with you and figure out what's best for you to handle your discomfort, pain, or need for anesthesia during a cesarean section, as well as postoperatively.
We have a full range of induction agents, augmentation agents. It's always a fluid conversation. The patients are able to always voice their concerns and what their desires would be, and patients, if they need a C-section or they want a C-section, will get their C-section.
The OR suite is brand new. It's state of the art. It will give you the safest birthing experience that you can get there.
I'm standing outside our dedicated operating room. This operating room is located on our labor and delivery floor and is used for cesarean sections only. So here we have our operating room table. Your anesthesiologist would be sitting up front here. Once we get you situated and settled prior to your surgery in the OR, we would then bring in your labor support person, and they would sit up here at the top of the bed with you to give you support during the delivery and also be present when the baby is born.
Northwell just put a lot of money into completely renovating what our unit looks like, from the flooring to the painting on the walls to the bathrooms. And so the patients come in now and it's a brand new, beautiful unit for their birthing experience. For the majority of the patient rooms that we do have are singles. I know the staff tries to keep patients in the individual rooms as best they can.
So you'll be welcomed into the room with your labor support person. You'll start your labor process in here. It turns into a full labor room. You'll actually have your baby here in this room. We'll bring in your crib. We have a nursery right across the unit. So for any reason, if we need to bring the baby into the nursery, the baby is extremely close to you.
It's very important that we have our privacy, and Peconic Bay Medical Center has private rooms to allow that.
Patients get to bond better with their baby without any sort of interruption. It's easier for them to have visitors and not worry if they're interfering with other patients' care. So I think the private room is a big thing for their experience. All of our rooms, we have central monitoring, so we can be in multiple locations throughout the hospital and still keep an eye on our patients.
What this monitor shows is we have the baby's heart rate, we monitor your contractions, so we can see this at the nurse's station. Everyone that is at the nurse's station can monitor you out here, as well as a monitor in every room.
Your meals are prepared and served by room service. You have a choice from a menu where high-quality food is prepared by our culinary chef.
They bring it at any time that you want it, and the food was great for both me and my husband.
So while you're here at the hospital, we do promote rooming in. We'd love for you to keep your baby for as long as you would like. You could keep it in the room with you for your whole experience. If at any point in time you do feel you need a little break, you'll be bringing your baby into the nursery. It's recently been renovated. We have state-of-the-art equipment. Sometimes your physician will come in and do an exam on your baby in here.
Our newborn nursery is led by our pediatricians. We have 2 on staff here. And if there's a high-risk delivery or an unexpected high-risk event occurs with the newborn, at Peconic Bay Medical Center, we have 24/7 neonatal teams available. The subspecialty team includes a certified neonatal nurse practitioner, as well as certified nurses and respiratory therapists. That team can stabilize and care for the baby, which parallels the care that the baby can get in the intensive care units at the mega centers.
Here at Peconic Bay Medical Center, we obviously want to promote the best outcome and a really family-centered birthing process. But sometimes babies do need some help. Babies are born early, otherwise known as prematurely. Sometimes they have difficulty breathing, or we worry about infections, so that's why we are here. As a neonatal nurse practitioner, we have extensive education and training to best care for your newborn.
We have state-of-the-art equipment to maintain and manage your baby's care if they have any needs, such as respiratory support. We also have the ability to allow your baby to grow with the isolettes that can provide heat, warmth, and humidity. This allows us to do the best for the babies.
This nursery has a live video connection between the COHEN's Medical Center, neonatal unit, and our unit. So this unit actually can be wheeled in front of the baby, and it's a live interactive discussion between our neonatal personnel and the neonatal specialists at Cohen's Medical Center.
There's nothing here that our doctors and our nurse practitioners can't handle. Even though we're at Peconic and even though we're in a community hospital, we still have the backing of the full Northwell health system. And if there's a problem, there's not a better system in the country that you'd want to be part of. We have Cohen's Children, we have NORSERY and LIJ, places that we could be in contact with immediately and transfer patients, whether it's via ambulance or the helicopters, as fast as we need to.
We have a lot of special services to offer the best care for mom and baby. We offer skin to skin immediately after delivery, whether you have a vaginal delivery or a C-section. Skin to skin is known to promote bonding and lactation. We have a donor milk program, so any mom who chooses to breastfeed and cannot produce the milk right away and her infant requires that, we can offer breast milk instead of formula or an IV to supplement that. On site here, we have lactation consultants. They offer prenatal breastfeeding classes, and then after delivery, they're here for a postpartum consultation. All our nurses are certified as breastfeeding coaches as well to reinforce what the lactation consultants have to offer. They also can connect with you after you go home if you have any issues breastfeeding your baby.
Parents, moms, dads are given a lot of instruction prior to discharge, how to take care of the baby, how to secure the baby into the car seat, preparation and guidance regarding follow-up appointments with the pediatrician, with the obstetrician. It's a very comforting feeling that you're able to ask questions and get answers to what you need to know in order to take care of your baby.
This hospital is special to me because I was born here. I feel I've come full circle by now working here, and I think about that every time I walk through those doors, that my mother had me here. And it's a privilege to be able to take care of mothers when they're having their babies.
I am a healthcare provider, but I'm also a mother, and I'm very confident to say that Peconic Bay Medical Center has the resources so that you will have high-quality care and a positive birthing experience that's safe for you and your infant.
I would 100% recommend coming to Peconic Bay Medical Center. I feel like I am in good hands, and I wouldn't have a second thought about coming back.
Thank you for taking the time to tour our facility virtually and to hear from our experts. We are here to care for your entire family. Congratulations on your pregnancy. We can't wait to help you welcome your new baby into this world.